Hi, maternal child health staff. In this short video, we will be discussing documentation. In some recent events, we've reviewed the records of charts, and it has been difficult to conclude what the scenario was at the time and to determine whether the standard of care was met. We all know that you're great and certainly practicing to the standard of care, so we want to help you. In this video, we will be talking about narrative documentation.
So in labor and delivery, there are several opportunities to document a narrative note. We never want you to prioritize documentation over patient care. However, documentation should take place as soon as possible in the EMR. For instance, Category 3 tracings like a terminal bradycardia, extramural deliveries, emergency C-sections, a shoulder, return to OR, or any other emergency that may occur.
In the Family Care Center, there are a few key opportunities to add a narrative note. Vital signs warranting further evaluation, such as severe range blood pressures, think preeclampsia. Decompensating patient requiring a rapid response, for example, a septic patient which can have a rapid onset. Antepartum patient with complaints such as contractions, bleeding, decreased fetal movement require fetal monitoring and documentation of complaints, along with interpretation of the strip and interventions. Patients with social issues such as postpartum depression or family concerns also require documentation. Last but not least, it is imperative to document a bleeding episode. Think postpartum hemorrhage and cumulative blood loss.
Already discussed in the other areas, there are unique circumstances within the NICU that require a narrative note as well. Think of your transfers, whether they're into the hospital or exiting the hospital. What led to the baby's transfer? What have you done about it? What condition was the baby received? What condition was the baby upon discharge? Families that were challenging or patients that were challenging while they were inpatients on the family center will continue to be challenging while the baby is in a prolonged stay in the NICU. Perhaps circumstances have changed since the baby was admitted. You may have to consult with social work and you want to be able to describe the circumstances that have now changed. Maybe you're concerned of an elopement with a mother whose baby is being held for CPS evaluation. Anything unusual that's going to continue to cause talk within the team typically needs to be documented in a narrative. Have you needed to call in a specialist? Was there a change in a baby's condition that requires a cardiology consult, a urology consult? Anything that led to those circumstances requiring the consult should be documented. Anytime a patient refuses treatment, which is their right, you do need to have documentation as to the conversations about and who consulted with the patient, what their rationale is for refusing the treatment, and what they were educated to as far as risks and benefits. Please be ensured this includes breast milk as well. Any inadvertent complication that arises during the course of the day requires a narrative note. This could be as simple as a disconnection or an infiltrate in an IV, warranting treatment. It could be as severe as a baby that was dropped inadvertently and required treatment or life-sustaining therapy.
There are other instances where we may need further documentation. For example, if you need to call a pediatrician or neonatologist back to the delivery room to assess something further on a baby, you would want to write a narrative note. Although we don't do complete assessments on the baby at the time of delivery, if you do notice anything out of the ordinary during your transition period, you would want to note that as well. Anything that's requiring further investigation would need to be documented. Our documentation needs to demonstrate that we're meeting the standard of care at all times. If we're investigating the EMR further, at times it can be difficult if documentation is in all different areas. We want your documentation to tell a clear story. So those are the additional instances where we may need to write a narrative note.
It sometimes is a challenge to write what happened well, and sometimes less is more. Finding the best balance of words and documenting is a skill you do not have to do alone. Reach out to a peer or get any one of us to help. Documentation is a priority after the patient care is given. I hope this overview can improve or increase all of our awareness on narrative documentation in our division. Thank you, and hope you enjoyed this video.